As a vision correction surgeon, we have multiple options now, but it's very important that you talk to the patients about what's their lifestyle, what's their hobbies, and what's their expectations. So you first have to listen to patients. On top of that, we do all of the diagnostics examinations. We look at the retina, we look at the tear film, we look at the cornea, all of that. After that, I make my decision in which lens I want to use in that particular patient. A lot of patients of mine, they come specifically to me to get rid of glasses. If they tell you they don't want any glare and halos, then the EVOLUX IOL is the lens to be implanted in my practice. The EVOLUX with the wavefront profile in the center, 4.5 millimeters in the optic, gives a very good intermediate vision without all those side effects we see with multifocal IOLs, like glare and halos at night. It has a typical 1.5, some patients 2 diopter of extra near vision, which gives a broad range. And that's why I told you that in the other eye, I want to target -0.5 to -3/4, which gives an extra near vision up to 40 centimeters. So when you have in one eye the distance until intermediate like 66 centimeters, when you have a -0.5, which gives you pull your image closer and it overlaps with the dominant eye, it gives very smooth transition from distance intermediate to near with a high quality of vision. And this is what patients like. On top of that, the refractive outcome. When you target plano, I want that lens to have a plano outcome. And with the EVOLUX, the A constant is very well, nicely tuned. So we get our refractive outcome as we targeted it in many cases. The EVOLUX IOL is my premium enhanced monofocal. One patient of mine was a taxi driver who has a +1.5 diopter for distance and +4 for near. And of course, because he's driving a taxi at night, so he did not want any glare and a halo. And in this regard, the EVOLUX IOL is an excellent lens in this kind of patients. This particular patient who ended up plano in one eye and -3/4 it up in the other eye, he could drive his taxi at night, no glare, no halos, no dysphotopsis whatsoever. So he told me that I changed his life. He's now independent from glasses most of the time, except for the very small print.